In early 2025, 65-year-old Betsy Arakawa died from hantavirus pulmonary syndrome, a rare but often deadly disease that many people have never heard of. Her death brought renewed attention to a virus that can strike unexpectedly and progress with alarming speed. What makes hantavirus especially dangerous is that people are often exposed without realizing it. By the time symptoms appear, the illness may already be advancing rapidly. Many assume hantavirus only affects campers, hikers, or people living in remote areas. In reality, exposure can occur in everyday settings where rodents have been present. In this video, we'll cover what hantavirus is, how it spreads, the warning signs to watch for, the unique risks for adults over 60, and the practical steps you can take to protect yourself and your family. This information could help you recognize a danger that too often goes unnoticed. Welcome back to the channel. I am Dr. Morgan Andewala, a cardiovascular surgeon with over 2 decades of clinical experience, treating patients with serious and complex medical conditions. Hantavirus does not just attack the lungs. In its most deadly form, hantavirus pulmonary syndrome, it rapidly progresses to cardiovascular collapse. The heart stops being able to pump. Blood pressure drops catastrophically. Multiple organs fail in sequence. It is a cardiovascular emergency disguised as a respiratory illness. And for anyone over the age of 60, particularly those of you with existing heart disease, high blood pressure, diabetes, or reduced lung capacity, the risk of reaching that cardiovascular collapse stage is significantly higher than for a younger, healthier person. Additionally, as you are about to learn, this virus is currently in the news for the right reasons, meaning people are finally paying attention. And I want to make sure that the attention being paid is based on accurate, medically sound information, rather than fear or misinformation. If you are watching this for the first time, please subscribe and hit the bell so you never miss content like this. I publish every week with the specific goal of helping you protect your health after 60. Now, let us talk about hantavirus. Everything, start to finish. What is hantavirus? Let us start at the very beginning, because most people have a vague, incomplete understanding of what hantavirus actually is. And that incomplete understanding is dangerous. The origins. Where did hantavirus come from? Hantavirus is named after the Hantan River in South Korea, where the virus was first formally identified in the 1970 seconds after an outbreak of severe hemorrhagic fever among soldiers during the Korean War. Military physicians noticed that soldiers were developing a mysterious illness with high fever, kidney failure, and bleeding, and could not explain why. Scientists eventually isolated the causative virus and named it Hantan virus. But while the formal scientific identification happened in the 1970 seconds, historians and medical researchers believe hantavirus has been infecting humans for centuries, likely millennia. There are descriptions in ancient Chinese medical texts, dating back over 1,000 years, that match the clinical picture of hantavirus hemorrhagic fever with remarkable accuracy. In the United States, hantavirus first made national headlines in 1993, an event that shocked the medical community and fundamentally changed how we think about rodent-borne disease. The 1993 Four Corners outbreak, America's wake-up call. In the spring and summer of 1993, a cluster of previously healthy young adults in the Four Corners region, where the borders of Colorado, Arizona, Utah, and New Mexico meet, began dying of a mysterious respiratory illness. They were not elderly. They were not immunocompromised. They were fit, active people in their 20 and 30 seconds, and they were dying within days of their first symptoms. The medical and scientific community was alarmed. CDC investigators were dispatched immediately. What they found was a completely new, previously unidentified strain of hantavirus, one they named sin nombre virus, which is Spanish for nameless virus. Unlike the Korean strains that primarily attack the kidneys, this American strain attacked the lungs with devastating efficiency. More than 50 people developed what we now call hantavirus pulmonary syndrome during that 1,993 outbreak. The case fatality rate was terrifying. More than half of those who became seriously ill died, and all of them had been exposed to deer mice, the primary carrier of the sin nombre virus in the American Southwest and West. That 1,993 outbreak was the event that placed hantavirus on the CDC's mandatory tracking list and established the national surveillance system that monitors cases today. The virus itself. What kind of pathogen are we dealing with? Hantaviruses are a group of RNA viruses carried primarily by rodents. More than 40 strains have been identified worldwide, with different strains associated with different rodent species and geographic regions. In the Americas, hantavirus infections most often cause hantavirus pulmonary syndrome, HPS, a severe illness that primarily affects the lungs. In Europe and Asia, hantaviruses more commonly cause hemorrhagic fever with renal syndrome, HFRS, which mainly affects the kidneys and blood vessels. Although these illnesses differ in how they affect the body, both can be serious and require prompt medical attention. Understanding which hantavirus strains are present in your region can help clarify potential exposure risks. The 2025 to 2026 outbreak. Why this is urgent right now. In February 2025, as I mentioned at the opening of this video, Betsy Arakawa, age 65, died of hantavirus pulmonary syndrome in her Santa Fe, New Mexico home. Her death was caused by the sin nombre strain, the same strain responsible for the 1,993 Four Corners outbreak. Her home had an active rodent infestation nearby. She almost certainly inhaled virus particles while going about her daily activities, never knowing the threat was present. Then in 2026, a completely separate and even more alarming outbreak emerged, this time aboard the MV Hondius, a cruise ship that departed from Ushuaia, Argentina, in April 2026 and traveled through remote areas of the South Atlantic Ocean. Multiple passengers became seriously ill. 3 died. By May 2026, the World Health Organization confirmed the strain responsible was the Andes virus, a South American strain of hantavirus notable for one terrifying characteristic that distinguishes it from every other known hantavirus strain in the world. The Andes virus can spread from person to person. Every other hantavirus strain requires direct contact with an infected rodent or its excretions. The Andes virus has been documented spreading through close human contact, through respiratory secretions, through shared living spaces, through sustained exposure to an infected individual. As of June 2026, 41 people across 16 American states, including former passengers of the Hondius and people who shared flights with infected passengers, are being monitored by the CDC. The outbreak remains active. The situation is evolving. This is exactly why you are watching this video today, and exactly why every person over 60 needs to understand this threat completely. How hantavirus spreads. Every route of infection. Understanding how hantavirus spreads is not just interesting science, it is survival information. Because once you understand the transmission routes, you can make specific, targeted changes to your behavior and environment that dramatically reduce your risk. Primary route. Inhalation of aerosolized particles. Inhalation. Specifically, breathing in microscopic particles of infected rodent urine, feces, or nesting material that have dried out and become suspended in the air as dust. Here is what this looks like in practice. A deer mouse, the primary carrier in North America, lives inside your garage. Over weeks and months, it leaves behind droppings, urine, and shed fur throughout the space. You have not seen the mouse itself. You may not even know it was there. One day you go into the garage to clean it out. You sweep the floor, you move boxes, you disturb old insulation. In doing so, you send microscopic dried particles of rodent excreta airborne. You breathe in that dust. And if that mouse was infected with hantavirus, which can survive in dried rodent excreta for several days at room temperature, you have just been exposed. This is exactly the scenario that public health experts believe likely occurred in the case of Betsy Arakawa. Her Santa Fe home had a rodent problem. She was 65 years old, a senior. She was going about her daily domestic life. The exposure likely happened in an ordinary, everyday moment that felt completely normal. And this is what makes hantavirus so insidious. You do not need to handle a sick animal. You do not need to be bitten. You do not need to do anything extraordinary. You just need to breathe in a room where infected rodents have been present. Direct contact transmission. Hantavirus can also be transmitted through direct contact, touching infected rodent urine, feces, or saliva, and then touching your mouth, eyes, or nose. This is a less common route than inhalation, but it is well documented and absolutely real. In practice, this means picking up what you think is ordinary debris and not realizing it contains rodent excreta, handling traps that have caught infected mice without wearing gloves, working in a garden or yard where rodents have been active, and then eating without washing your hands. For older adults, this route deserves particular attention because reduced hand sensitivity and reduced awareness of small skin breaks can make contamination more likely. Rodent bites. Direct bites from infected rodents can also transmit hantavirus, though this is significantly less common than inhalation. It is primarily a risk for people who handle live rodents, pest control workers, farmers, laboratory researchers, rather than the general public. However, for anyone over 60 who finds a mouse trapped or injured in or around their home and attempts to handle it directly, please wear thick gloves. Do not handle rodents with bare hands under any circumstances. The Andes virus exception, person-to-person transmission. As I mentioned earlier, the Andes virus, currently causing the 2026 cruise ship outbreak, is the only known strain of hantavirus that can spread from one infected person to another. This is a critical distinction from all other hantavirus strains. Based on data from past Andes virus outbreaks in Argentina and Chile, person-to-person transmission appears to require close, sustained contact with an ill individual, particularly through respiratory secretions. Sharing a living space, sleeping in the same room, or providing close personal care to someone in the acute phase of Andes virus infection appear to be the primary human-to-human transmission scenarios. The current 2026 outbreak is being carefully monitored for any evidence of wider human-to-human spread. The CDC has confirmed that no Andes virus cases have been identified within the United States as of this recording, but the situation is evolving and warrants continued vigilance. Incubation period, the silent window. One of the most challenging aspects of hantavirus infection is its incubation period, the time between exposure and the onset of symptoms. This period can range from about 1 to 8 weeks, meaning a person may feel completely healthy for weeks after exposure. When symptoms finally appear, they often begin like the flu, but can progress rapidly over several days to severe respiratory illness. Because of this delay, remembering and reporting any possible rodent exposure is extremely important. If you develop flu-like symptoms within several weeks of cleaning a cabin, working in a barn, handling stored items, or encountering rodent droppings or a dead mouse, be sure to tell your healthcare provider. That information can play a crucial role in reaching the correct diagnosis quickly. Which rodents carry hantavirus, and where? Not all mice and rats carry hantavirus, but the ones that do are far more widespread than most Americans realize. Let me walk you through the primary carriers by region, because your geographic location is one of the most important determinants of your personal risk level. The deer mouse, the #1 threat in North America. The deer mouse, scientifically known as Paramyscus maniculatus, is the primary carrier of sin nombre virus, the deadliest hantavirus strain in the United States, and the strain responsible for the majority of American hantavirus deaths, including Betsy Arakawa. Deer mice are extremely widespread. They are found in virtually every rural and semi-rural environment across the continental United States, from Alaska to Florida, from the Pacific coast to the Mississippi River. They are most abundant in the western and southwestern states, which explains why the vast majority of hantavirus cases in the U.S. occur in this region. Deer mice are small, typically 3 to 5 inches in body length, with a distinctively bicolored tail that is light on the bottom and darker on top. They are primarily active at night. They prefer outdoor habitats but readily enter homes, garages, barns, cabins, sheds, and any other enclosed structure that offers warmth and food. Critically important, studies estimate that up to 12% of deer mice in endemic areas may be infected with sin nombre virus at any given time. They carry the virus throughout their lifetime without becoming ill themselves. They shed it continuously through their urine, feces, and saliva. The white-footed mouse, Eastern United States. The white-footed mouse is the primary carrier of hantavirus in the eastern United States. It is associated with the New York virus strain, a hantavirus that can cause HPS, though typically with a somewhat lower fatality rate than sin nombre virus. White-footed mice are extremely common in suburban and even some urban environments in the Northeast and Mid-Atlantic states. They frequently enter homes, particularly in autumn as temperatures drop. The cotton rat and rice rat, southern states. In the southeastern United States, particularly Florida, Georgia, the Carolinas, and neighboring states, the cotton rat and rice rat are documented carriers of hantavirus strains called bayou virus and Black Creek Canal virus. These strains are less commonly associated with severe human illness than sin nombre virus, but cases of HPS have been documented. The Norway rat, urban environments. The Norway rat, commonly found in cities and suburban neighborhoods, can carry SOL virus, a type of hantavirus linked to serious illness. Because these rats live in urban as well as rural environments, potential exposure is not limited to people living in the countryside. This is an important point. If you have had rats in your home, apartment building, or surrounding area, you may have been near a potential hantavirus carrier. There is no need for alarm, but it is a good reason to stay informed and take rodent infestations seriously. High-risk geographic areas in the United States. Based on CDC surveillance data, the states with the highest number of reported hantavirus cases are New Mexico, Colorado, Arizona, California, Utah, Texas, Montana, Washington, and Oregon. However, cases have been confirmed in at least 34 states. The risk is real, and it is geographically widespread. High-risk settings, regardless of state, include rural properties with outbuildings, barns, or sheds, vacation cabins or hunting camps that are infrequently used, homes with basements, attics, or crawl spaces, any building where signs of rodent activity, droppings, gnaw marks, nesting material have been observed. Warning signs, every symptom, every stage. Now we get to the most critical information in this entire video. The warning signs, the symptoms, the timeline, what happens to your body when hantavirus takes hold, and what to look for before it becomes fatal. I want to organize this section carefully because hantavirus pulmonary syndrome, the American form of this disease, progresses through distinct phases, each with its own set of symptoms. Understanding this timeline could mean the difference between surviving and not surviving. Phase 1, the prodromal phase, days 1 to 5. The prodromal phase is the first stage of illness, typically beginning 1 to 5 days after symptom onset. This is the phase that fools almost everyone. It fools patients. It fools family members. It sometimes even fools physicians who are not specifically thinking about hantavirus. Because the prodromal phase of hantavirus pulmonary syndrome looks almost exactly like influenza. Warning sign number 1, fever, usually 101 to 104 degrees Fahrenheit. This is typically the first and most prominent symptom. The fever often comes on rapidly and can be quite high. For seniors over 60, it is important to note that the normal febrile response can be blunted by aging and by medications, particularly corticosteroids, NSAIDs, and some blood pressure medications. This means some older adults may not spike as high a fever, or may delay developing fever, which can create a false sense of security. If you are over 60 and your normal baseline temperature is on the lower side, even a temperature of 99.5 or 100 degrees Fahrenheit should be taken seriously in the context of other symptoms. Always measure your temperature with a thermometer rather than relying on how you feel. Warning sign number 2, deep muscle aches, myalgia. Severe muscle pain is one of the hallmark symptoms of hantavirus and can help distinguish it from a common cold or mild flu. The pain is typically deep and intense, affecting large muscle groups such as the thighs, hips, lower back, and shoulders. Many patients describe feeling as though their entire body aches, making everyday activities difficult. This is far more severe than the typical body aches associated with a common cold. In older adults, this symptom is often mistaken for arthritis, fibromyalgia, or simple overexertion, which can delay diagnosis and treatment. Warning sign number 3, profound fatigue and weakness. The fatigue of early hantavirus infection is not ordinary tiredness. Patients describe a sudden, overwhelming exhaustion, a heaviness in the limbs and body that comes on rapidly and is completely disproportionate to any activity level. This is distinct from the gradual fatigue of chronic illness. It comes on fast, within hours to days, and is severe enough to prevent normal functioning. Many patients report feeling fine one day, completely normal, and then barely able to get out of bed 24 to 48 hours later. This rapid onset of severe fatigue is a critical warning sign. Warning sign number 4, headache. A severe, persistent headache, often described as a pressure headache or pounding headache, is present in the majority of hantavirus cases. It tends to be resistant to over-the-counter pain medications and does not improve significantly with rest. In some cases, the headache is frontal, behind the forehead. In others, it is occipital, at the back of the head and neck. For older adults taking aspirin or NSAIDs regularly for arthritis or cardiovascular protection, it is worth noting that these medications may partially mask the headache severity. Another reason not to rely on symptom intensity alone as a gauge of illness severity. Warning sign number 5, nausea, vomiting, and abdominal symptoms. Approximately half of all patients with hantavirus pulmonary syndrome develop significant gastrointestinal symptoms in the prodromal phase, including nausea, vomiting, diarrhea, and abdominal cramping or pain. These digestive symptoms often lead patients to self-diagnose food poisoning or a stomach virus, further delaying them from seeking appropriate care. This is particularly important to know because GI symptoms combined with flu-like illness in a senior often results in a visit to urgent care rather than an emergency room. And at urgent care, without a specific history of rodent exposure, hantavirus may not be considered. Warning sign number 6, dizziness and lightheadedness. Significant dizziness, particularly upon standing, is present in many early hantavirus cases and reflects the beginning of fluid shifts in the vascular system that will become much more pronounced in later stages. For older adults who already experience some degree of orthostatic dizziness from blood pressure medications or dehydration, this symptom can easily be dismissed as a medication side effect. Warning sign number 7, chills and sweating. Alternating chills and sweating, accompanying the fever, are classic prodromal symptoms. These can be dramatic. Patients describe episodes of uncontrollable shaking and chills, followed by drenching night sweats. For older adults, these episodes can be profoundly disorienting and physically exhausting. The critical transition point, days 4 to 10. This is often the stage that determines survival. After several days of severe flu-like symptoms, some patients may appear to improve briefly. They may feel a little better, leading families to believe the illness is passing. Unfortunately, this temporary improvement can be misleading. It may occur just before the most dangerous phase begins. Be alert for this pattern. Severe flu-like symptoms, a brief period of improvement, followed by sudden breathing difficulties. If this happens after possible rodent exposure, seek emergency medical care without delay. Phase 2, the cardiopulmonary phase, the emergency. Phase 2 is where hantavirus becomes acutely life-threatening. It typically begins 4 to 10 days after the first symptoms appear, sometimes within as little as 24 hours of phase 1. Warning sign number 8. Shortness of breath, the most critical symptom. The sudden onset of shortness of breath is a medical emergency and requires immediate hospital care. At this stage, hantavirus causes fluid to leak from blood vessels into the lungs, making them heavy and unable to exchange oxygen properly. This can lead to rapid respiratory failure, sometimes within just a few hours. For older adults, the risk is even greater because aging lungs and conditions such as COPD or asthma leave less reserve to cope with the damage. If breathing becomes difficult after flu-like symptoms, especially following possible rodent exposure, do not wait to see if it improves. Seek emergency medical attention immediately. Warning sign number 9. A dry, persistent cough. A dry, non-productive cough, meaning a cough that brings up little or no mucus, typically accompanies the development of respiratory distress in hantavirus pulmonary syndrome. Unlike the productive cough of a bacterial pneumonia, the hantavirus cough is dry and tight. It may feel like a constriction in the chest rather than a typical respiratory cough. This cough is the body's attempt to clear fluid from the airways, and it signals that fluid accumulation in the lungs has begun. Warning sign number 10. Chest tightness and pressure. As fluid builds up in the lungs, patients may feel chest tightness, pressure, or heaviness that can resemble a heart attack. During this stage of hantavirus pulmonary syndrome, the heart is placed under severe strain as it tries to compensate for failing lungs. Dangerous complications such as irregular heart rhythms, low blood pressure, and shock can develop rapidly. For seniors with existing heart conditions, such as coronary artery disease, heart failure, or arrhythmias, this added stress greatly increases the risk of death, as the heart may not be able to keep up with the body's demands. Warning sign number 11. Rapidly dropping blood pressure. As the cardiopulmonary phase progresses, blood pressure can drop dangerously low, leading to shock, a condition in which vital organs no longer receive enough blood and oxygen. Patients may become confused, weak, or unconscious, and often require intensive care and mechanical ventilation. At this stage, hantavirus pulmonary syndrome carries a mortality rate of roughly 30 to 50%, even with advanced medical treatment. That is why early recognition, prompt diagnosis, and timely hospitalization are so important. Special warning signs in seniors. The diagnostic challenge. One of the biggest challenges in diagnosing hantavirus in older adults is that its early symptoms are often mistaken for other common conditions. Fatigue may be blamed on age, muscle aches on arthritis, breathing problems on heart or lung disease, and dizziness on medications. Because these symptoms can be easily explained by existing health issues, a history of rodent exposure becomes especially important. If an older adult has been exposed to rodents within the past 4 to 8 weeks and then develops flu-like symptoms, hantavirus should be considered. Family members and caregivers should mention any possible rodent exposure to healthcare providers right away. Do not assume the connection will be made automatically. This information could help lead to an earlier diagnosis and faster treatment. Ending of Part 1. Those are the warning signs every senior should know. Some symptoms may seem mild at first, just a fever, fatigue, or body aches. But with hantavirus, what starts as something that feels like a common illness can sometimes become much more serious in a matter of days. That's why recognizing these signs early is so important. But symptoms are only part of the story. What many older adults don't realize is that the biggest danger often comes long before symptoms appear. In many cases, people are exposed to the virus without even knowing it. Certain everyday activities, common household situations, and hidden risk factors can dramatically increase the chance of exposure. In our next video, we're going to reveal the high-risk situations every senior needs to avoid, the places where exposure is most likely to happen, and simple steps that could help protect you and your loved ones. You won't want to miss it. Stay safe, stay informed, and we'll see you in the next video.